Welcome back. I'm Dr. Mary Owen, Associate Dean of Native American Health, Endowed Professor of Native American Health, and Director of the Center of American Indian and Minority Health at the University of Minnesota Medical School in Duluth. I have no relevant disclosures. Our next session, focuses on advancing trust and ethics in community-based research. What are the next steps needed? Our speakers are Professors Vince Bonham and Maya Sabatello, who will consider challenges and successes in partnering with different communities in research. Each speaker will present for about 20 minutes, and then we'll turn to audience questions. You can post your questions in the Q&A on Zoom and upvote questions using the thumbs up icon. Our first professor is Professor Vince Bonham. Professor Bonham is President and Chief Executive of the Diaspora Human Genomics Institute at Meharry Medical College and Founding Director of the Meharry Center for Bioethics, Social, and Behavioral Research. In 2023, the Genomics Institute launched a 10-year research project to build the first comprehensive international database for people of African ancestry to address the underrepresentation of Black populations in genomic and medical research. And at the Center for Bioethics, Professor Bonham works to advance interdisciplinary scholarship at the intersection of ethics, genomics, and health, examining how social, cultural, and behavioral factors shape health outcomes. Previously, Professor Bonham served as the acting director and deputy director of the National Human Genome Research Institute at the National Institutes of Health. He has no relevant disclosures. Please join me in welcoming Professor Bonham. Thank you, Professor Bonham.
Thank you, and thank you, Dr. Owen. First, thank you for the invitation to be part of your Research Ethics Day today and this important conversation that you're having with regards to the issues of research ethics in this challenging time that we live as we move forward in biomedical and community-based research. My talk really is focused on community-based or community-engaged research and thinking about what are the important research ethics questions that we must consider within this current time. And so I want to explore that in a number of ways. Next slide. And as stated, I had no disclosures. So my framing of my talk is this. How to preserve key safeguards while making improvements in community-based research ethics. And what I would like to do in my few minutes today is really to focus on three areas that I think are core with regards to advancing research ethics and community-based research. First, transparent research. Second, trustworthy research. And the third area is power dynamics in community-based research. And as I've listened to the talks earlier in the day, these are themes that have been coming up throughout the day in various ways around transparency and trustworthiness, particularly. But a recognition, I think, when we think about it in a community-based context, I think that there are important issues that we need to be thinking about as we advance research in an ethical manner. Next slide. So when I think about transparency and related to community-based research, I think we're really exploring this question about when you're working with communities and community participants, what do they understand about the study that's being conducted, their role in the study, how you are actually going to use the data, and being important with regards to expanding the understanding of communities so that they are actually partners in that research from a perspective of understanding the study design, understanding the potential use of the data, and understanding a potential risk related to that. And so transparency is really, I think, a core issue when we think about research ethics today, and particularly with the shifts and changes that are happening with regards to research regulations, that we understand and explain to communities what it means to them to participate in the study and what is their role and how can they help be true partners in the research. Next slide. So when I frame transparency, I really take these 5 areas that we should talk about and focus on. First, full disclosure of the research process, the ability to make sure that the participants understand the processes of the research protocol and the research design. I heard that in the last panel, that's an important component of the work that we're doing. The second area is clear procedures for decision making. It needs to be clearly identified who's making decisions, the process of decision making within that research, and that's articulated appropriately to participants and to all the members of the research team. And the third area is respecting community experiences. I think this is a core issue that we always have to keep front and center is the role of the community with regards to the work that's being done. Too often, researchers will lead and leave the community behind and try to bring them along. And it's important that we recognize and respect the community experiences. And the fourth area is respecting community knowledge, that we're really in a community-based engaged research process. We're relying on the knowledge of the community and their experiences that they have to help to make sure that the research is robust. And then finally, dissemination of research outcomes, making sure that we're giving back to the participants, that we're giving back to the community, the findings of the work, that we are sharing it in an appropriate way, not just in a scientific journal that may be behind ability to get access to it because of a cost to get access to an article for a member of the public, that we provide that information to the public in a way that it's accessible to them and is appropriate from the perspective of that community. Next slide. The second area that I want to focus on, and I'm going to spend a little time, is around trustworthiness and trust. And I believe that the fundamental basis of community-based research must be based on a trustworthy researcher institution working with the community. And that we must always be framing and thinking about whether we have established appropriate, trustworthy infrastructure for the work that's being done. Next slide. So when I think about the ecosystem for research, particularly related to trustworthiness, I want to make sure we're looking at and thinking about a number of different areas within the ecosystem and really exploring them and the roles that they have. Clearly, the researcher is number one, and making sure that the researcher is trustworthy with regards to the work they're doing, their communication with the participants, their involvement with the community, but also the research institution. The institution that that researcher works for has an obligation. That healthcare institution, that university, that research institute, whatever that institution and the role of that institution in maintaining the trustworthy relationship with study participants, I think is fundamental. But a third area that I think that we must address now is funding agencies, and that the funding agencies play an important role. And as funding agencies and their priorities and their decisions that they make with regards to what research can be conducted and what research cannot, is in a fundamental area for when we think about trustworthiness related to community-based research. And so that's important. And the fourth area is industry and commercial partners. As with my introduction, I now work in a setting where I work with pharmaceutical companies and private industry partners, being transparent about their relationship, being transparent about working with them, I think is an important part of maintaining that trustworthy type of program. And then finally, government agencies in biomedical research. As government agencies establish new regulations and responsibilities that guide research, they too play an important role with regards to the trustworthiness of the research setting for community-based research. Next slide. So I like this definition of trustworthiness that was put together by Dr. Derek Griffin. This work that he's done in really kind of thinking about some of the fundamental foundations of trustworthiness, I would encourage people to read if they have not. But I'm just going to read this quote from one of his papers. Trustworthiness is a commonly recognized antecedent to trust. Can be described as a perception of probabilities or expectation that a trusting relationship will result in gains and or losses from engaging in an encounter that requires trust, risk, uncertainty, and interdependence. Trustworthiness begets trust by giving patients or study participants a reason to trust. So this issue of creating a trustworthy basis of foundation of work is important for community-based research. Next slide. So mistrust has been defined as the general sense of unease or concern that a provider or institution may not act in a person's best interests. Next slide. And so I'm going to talk a little bit about some work that I've been involved in over the last few years of creating a new measure for assessing institutional medical mistrust. Institutional mistrust, I think, is really important for us to think about related to community-based research because of kind of the influence and the role that institutions have on the total research enterprise. And so assessing that and assessing how participants, how the general public thinks about institutional mistrust. Next slide. So my group has been involved in establishing a new measure that has three different domains to it. One is focused on healthcare institutions and their mistrust. The second is state and local government and mistrust. And the third area is federal government and mistrust. And again, it's really the context of thinking about conducting research and the role of healthcare institutions, the role of state and local government, and the federal government. Next slide. So we created a measure that has 7 items. And again, there are 3 subscales, one for each domain, institutional domain, and asking questions with regards to the perceptions of participants, of individuals taking the survey of mistrust. This work came out of the COVID pandemic and has now expanded of thinking about the issues of institutional trust in all settings and not just the COVID pandemic. But we explored this issue initially with the COVID pandemic. And I just want to share with you some of the findings that we had that I think are important from the context of our discussion that we're having today. Next slide. So we surveyed 1,273 individuals across the United States. And using this measure and the 3 subscales, we asked questions about trust related to healthcare organizations, local state government, and federal government. And we found in our survey that the highest mistrust was with the federal government. And then followed by local and state government with the lowest with healthcare organizations. This work was surveyed in 2022, but I would argue in 2026 that we'll have similar findings and there may be more separation between the types of institutions with regards to this issue. So when we think about this as researchers and as institutions that are responsible for managing and conducting and leading research, we need to think about this question of how the public, how our study participants perceive us, perceive other parts of the research ecosystem, particularly the federal government and state and local government. And so what are the things that we need to be thinking about as we work with communities and we communicate about trust and our role of our institutions with that research? Next slide. So I'm going to shift a little bit now, and I'm going to give 2 case studies that I want to just briefly highlight. So as we have our conversation later in this panel, that maybe we can connect around some of the issues of these case studies. And the first case study comes directly from my own research that I've conducted and a project that we have that's called the Democratizing Sickle Cell Disease Gene Therapy Education. And this is a project where we brought together community stakeholders to build new patient education materials for sickle cell disease gene therapy. Next slide. So the stakeholders in this project included individuals living with sickle cell disease, so patients that are involved with getting healthcare as well as involved in research, individuals who had gone through a clinical trial for gene therapy. So we brought individuals who had had the experience of going through sickle cell disease gene therapy. We brought the researchers who were conducting gene therapy research. We brought industry representatives that were leading the development of these new treatments, advocacy groups, health professionals, government representatives, and really brought this group of individuals together so that we were bringing the perspectives of both the scientific community and the lay advocate community and patient community to think about what are the important information that's needed for the community and what are the barriers that were there that day with regards to access of gene therapy information. Just for your information, there are now 2 gene therapies that have been approved by the FDA for sickle cell disease. There's ongoing clinical trials with regards to gene therapy. This is an important area kind of at the forefront with regards to gene therapy coming to the clinic. Next slide. So we asked a number of questions of the participants in the study. We asked, how accurate is sickle cell disease gene therapy information currently? And we found that the majority of the respondents said that current patient education materials for sickle cell disease gene therapy were somewhat accurate. But others thought it was more accurate, but 62% thought it was somewhat accurate. Next slide. We asked the question, how accessible is the information for individuals and families seeking to learn more about sickle cell disease gene therapy? Only 2% of the respondents said that patient education materials are very accessible. And again, these are all of the participants coming from the scientists, the researchers, the patient advocates, the patients, that there was a clear opinion that materials were not accessible to the community. Next slide. So we moved together with the community, with the representatives from the community, to create new patient education materials. We brought these groups together over time. They worked in a collaborative way to identify what types of materials were needed, and then to develop the materials, to review drafts of materials. And I just refer you to the QR code and to learn more and to see the materials that came out of this work, as well as to the publication that talks about the process that we went through. But I want to highlight one specific issue. Next slide. We asked a question in our survey of the participants over the meetings we had. We had meetings over 4 different time periods. And we asked at 3 of those time periods this statement: I believe differences in power between the stakeholders are influencing the nature of this meeting. And what I want to do here for you is just highlight the difference in the response of the patient advocacy community versus the research community. That you see a very different view with regards to power in this community engaged research project. That the patients and the advocacy community did see a power differential, and the research community was blind to it and did not see that there was a power difference. And I think that's important as we think about ethics and community-based research, that we think about this issue of power. Next slide. So the second, so clearly power dynamics is important. Next slide. So the second case study I want to provide you really is from my role as a administrator at the federal government, engaging with tribal nations regarding genetics and genomics. Over my 23 years at the National Human Genome Research Institute, I had the honor of working with a number of different tribes around the issues of genetics and genomics, both the history as well as how we look forward to the future and advancing the health for everyone. And I just want to highlight one of the issues related to that. Next slide. So there's a clear recognition that there has been a history with regards to the field of genetics and genomics that has not always been positive in work with tribal nations. Don't want to focus on that specifically today, but to give that as the context of thinking about research ethics and community-based work. Next slide. So one of the things that we did was we established a program where we brought different individuals, researchers from indigenous researchers, senior leaders from various tribes together, individuals from government together to have conversations, to sit in circle, to really to explore the issues of what are the issues we need to be thinking about with regards to policies and advancing genetics and genomics research. And that was a core issue of opportunities to work with the community and recognition that the community must lead and we must listen. And so that is a context that I think we need to think about community-based research. Next slide. And clearly, one of the things that came out of all that work was an expectation that leadership would come from indigenous researchers, not from the government. That we need to ask indigenous leaders to really explore. And I just highlight several articles that have been published by colleagues that are led by indigenous researchers, really focusing on these questions about working in the field of genetics and genomics. Next slide. So the message here with regards to the second case study is that researchers must listen to the community and its needs. We must recognize, particularly when we are working with different communities that have historical trauma that's related to research, that we are not, as researchers, not from those communities, leading, but following and being guided by the needs of the community. Next slide. So I want to close with this. This is from a paper that was just published in January of this year, coming from the AAMC on principles related to trustworthiness. And they included this figure that I really liked in the paper. When we think about trustworthiness related to community-based research, we need to think about and listen, connect with community partners, reflect, compare community perspectives to the principles, act, to co-create and prioritize action, and then revisit, check, process, and adjust. We must continuously have a process of engagement with the community to build that trust and to build a trustworthy environment. Next slide. So with that, thank you, and I look forward to our conversation.
Thank you, Professor Bonham. That was great. Our next speaker is Dr. Maya Sabatello. Dr. Sabatello is Associate Professor of Medical Sciences in the Center for Precision Medicine and Genomics and the Division of Ethics in the Department of Medicine and Department of Medical Humanities and Ethics at Columbia University. She co-directs the Precision Medicine Ethics, Politics, and Culture Project. She has extensive experience in national and international policymaking on human and disability rights. Her work explores the ethical, social, and policy issues relating to biomedical technologies, genomic information, and big data, including the impacts on marginalized communities, individual rights, and health outcomes. Professor Sabatello is a member of the American Society of Human Genetics, Professional Practice and Social Implications Committee, and the IRB for the NIH All of Us Research Program. She also co-chairs the National Human Genome Research Institute, Community Engagement and Genomics Working Group. She has no relevant disclosures. Please join me in welcoming Dr. Sabatello. Thanks, Dr. Sabatello.
Thank you so much. Such an honor to be here. What a great conference and really great presentation so far. Again, I've been invited to discuss engagement with disability communities in research, situating it in the larger context of research ethics and both current challenges and future opportunities. And so besides saying that these are some of my conflicts of interest and that they've also been mentioned, and I'm speaking only in my personal capacity today, what I hope to do is start with some background on community engagement and the disability community, focusing on genomic and precision medicine research. I will then discuss some challenges and finally opportunities for growth in research ethics and disability community engaged research. So the movement of community engagement in genetic and genomic and precision medicine research emerged given the underrepresentation of especially racial and ethnic minorities in existing cohorts, which reduces the generalizability of scientific findings, and recognition that engaging such communities in research can inform about their needs and values and improve community health outcomes in the long run, which Vance also touched on in his case studies. Community-engaged research builds on personal relations, local knowledge, and deep trust between researchers and communities, and it fits with the broader understanding that ethical research, ethical health research, is not only about who is included in research, but also about who makes decisions about what is studied, funded, and disseminated, and who gets to have a say in research findings that affect public policies. So while there's variation in how community-engaged research studies are being done, at its best, it involves power sharing, bidirectional learning process, and co-production of knowledge, research design and outcomes that are informed by community needs and values, and commitment to promote broader community justice, recognizing community context and acting on societal power dynamics to improve long-term community health outcomes. Now, the All of Us research program actually was the one that cemented the rise of community engagement as an ethical practice in precision medicine research, and then expanded even further to other biomedical research more generally, calling for a new paradigm of research engagement and committing from the get-go to identifying ways to leverage grassroots movements. And I think it had a pretty notable success in creating a very large cohort with more than 50% of racial and ethnic minorities, about 80% of the cohort of underrepresented groups more generally, including some people with disabilities, and with 77% of its genome sequence data collected from participants from historically marginalized communities. So when we think about community engagement with the disability communities, it should be kind of a no-brainer for ethical implementation of genomic and precision medicine research. It's a large population, about 20% of children and 29% of adults in the United States, that experiences significant health disparities and worse health outcomes. It's significantly underrepresented in general, that is not disability-specific health research, including genomic and precision medicine research cohorts that could, in the long run, inform their health outcomes. And as a community, people with disabilities are probably most reflective of the conceptual shift in research ethics, moving from the historical view of human subjects as mere databases to be observed, dissected, and studied, to research participants and partners. We also know that people with disabilities actually want to be involved and engaged as equal partners in precision medicine research studies. And these are a couple of my studies that I have done. And they want to mostly be involved in determining study questions and design and helping with recruitment and data collection. And what we've heard from participants with disabilities in my community engaged trust study, and although we did not actually ask them about community engagement, but they brought it up and said that community engagement is a key component for trust in precision medicine research, highlighting that such effort must include accessibility as an act of respect, knowledge of disability history, rights, and needs, and broad perspectives, broad representation considering the community heterogeneity, as well as commitment to disability justice, including recognizing intersectionality and investment in the community to promote long-term benefits. And all of that really fits with a lot of the work and long history of political mobilization of people with disabilities and their motto of nothing about us without us. But disability community engaged research in genomic and precision medicine research has faced and still faces some roadblocks. And so I'm hoping to shed light on some of the three key areas, which are researchers, the broader, what I call the broader research ethics ecosystem, and then research-related policies, specifically data sharing. So with regards to researchers, despite a lot of hope about community engagement in research, to date, only a handful of studies have actually utilized community engagement with disability communities. And those that exist and focus on adults with disabilities mostly use stakeholder engagement, which is sometimes used interchangeably with community engagement, but it's actually broader and solicits feedback not only directly from members who are directly impacted, but also from larger and various groups. And usually what we see is that there's no clarity about the number of adults with disabilities who are included, how they've been engaged, what accessibility measures were given to them, and the extent to which they actually were able to contribute to the scientific endeavor, given the lack or existence of accessibility measures. So there's some sort of risk here that even though you hear about it much more today, that there's some sort of tokenism around participation or engagement with disability communities, which undermines the goals of community engaged research and harms trust in the scientific outcomes. Now, what can explain that? Of course, there are different reasons that might explain that. I think time commitment is one issue that researchers might be thinking about, especially in these times when we have such shortage with funding. But building trust before study begins takes time, and it is not covered by grants. And assuring processes to meaningfully engage with communities during the study, again, recognizing the power dynamics and how to arrange them within that setting is also taking time. And again, it's a lot of time when we're trying to fit everything into grants. Another possible reason is that we view views that center expertise about disabilities as well as experiences in the hands of the many, clinicians, parents, guardians, and caregivers, but not so much in the hands of adults with disabilities. And that doesn't mean that it's not necessarily correct. There is a whole environment and interdependency and a lot of important views, but it might sometimes also be connected to the misperception of incompetency among people with disabilities, even though we know that most adults with disabilities do not have a guardian, can make decisions, and be actively involved and engaged in research. And finally, researchers are often concerned about disability accessibility, which is a right in federal law and disability laws more generally. But a researcher's responsibility, it's often been perceived as a burden rather than an actual responsibility, even as many of the modifications are actually low cost or no cost at all. A second challenge in community engaged research in general, and also specifically with regards to folks with disabilities and disability communities, is that it requires considerations of contextual factors that have not been part of the traditional focus in research ethics. And I think we've heard some of that this morning in some of the meetings as well with Barbara and others. But the idea is that this broader research ethics ecosystem is actually quite critical. Many research institutions for example, have community engaged portfolio. However, similar to IRB reporting criteria, they commonly treat marginalized communities as homogeneous, only Blacks, only Hispanic, but with no considerations of intersectionality, which again is pretty much an inherent characteristic of the disability community. Existing structures are also such that external funding is essential to allow for proper disability engagement, community engagement research. Generally, few funders, except for the federal agencies, actually support disability community engaged work, especially in the context of genomic and precision medicine research. And this funding comes with challenges for community partners, both individuals and organizations. First, because the timeline on grants can be very demanding for community members who are not full-time researchers. Second, the structure of the grantsmanship, again, regardless of who the funder is, kind of makes them vulnerable, both financially if they're supported in grants and without backing of research institutions behind them, and in terms of loss of investment, the time, labor, and effort that they lose when funders' agendas change or projects they work on are being discontinued. And finally, we have non-optimal, to say the least, public services on both federal and state levels, such as healthcare, education, and social security income that interact with research ethics and likely to disproportionately affect folks' disability community engaged effort. And healthcare is a great example. We know from history that when federal and state level budgets for public healthcare shrink, people with disabilities are at the front line to experience the backlash. About 33% of adults with disabilities receive Medicaid, 50% receive Medicare. And these are insurances that cover critical disability services that support daily life activities, including home and community services. And so taking those different budget cuts have a really immediate impact on the community, creating instability or lack of resources, and therefore it's associated also with lack of health insurance, loss of health insurance, increased expenses of worse health outcomes, and risk of being moved into nursing homes, alongside with additional burden on disability organizations that support their members, all of which kind of really seem to be, when we're thinking about healthcare, as something completely disparate, or education, but ultimately these other areas of life are really interdependent and create that interdependency within the research ethics ecosystem, because they affect who can participate or engage in the implementation of research ethics. And then the last roadblock that I want to point out is requirements around data sharing in genomic and precision medicine research that increasingly raise the risk, not only for individuals, but mostly also for group harms. These concerns are pronounced when data are collected in community-engaged studies, as the researchers lose control over the data, including ability to uphold their commitment to promote community benefit and justice in the long run. With the disability community, data sharing raises a mix of concerns that we've heard, including eugenics of cultural community, misuse of data to reinforce medicalization or social biases against this population, growing worries about the risk of re-identification in data linkages, which was recently proposed regarding the autism registry, for example, and the possible use to justify reduced disability benefits. And in addition, sharing data collected in disability community-engaged research raises populations' health injustice, as secondary users often develop products from medications to tech devices that are not disability accessible, let alone affordable. Now, that doesn't mean that we should not be doing data sharing. We've heard from both autistic researchers, as well as in our study of 150 adults with intellectual disability, that data sharing can offer important health benefits to the disability community, such as tailored cancer treatments, gene-environment interactions, and others. However, these risks and concerns about group harm really call on all of the research actors and research ethics administrator to actively engage with the disability community to address the worries and to facilitate the work of researchers who are grappling with how to responsibly share data they collected in their studies. And again, the only way to do that would be through community-engaged studies. So what are some of the steps ahead? So I think one of the good news is that disability community engagement research is still on the map, with robust community engagement explicitly included in the NIH's recently published Strategic Plan for Disability Research, Health Research for 2026 to 2030. We're still waiting to hear what this means in practice, but in the meantime, we do need to consider approaches to support existing and future community engaged studies. So in the short time, I think research really do have a primary responsibility towards the communities they work with to minimize the harm when their studies are experience financial delays or are discontinued. First of all, by what Vance mentioned as transparency, but it is communicating challenges to the community members, sharing what's going on, and as much as possible, continuing the research if possible, as well as sticking to the ethical obligations that arise from community engaged research to promote community well-being and justice in the long run. And while research institutions may themselves be under financial constraints during this time, I would argue that making resources and bridge funding available for existing community engaged research efforts that actually should be part of the institutional commitment to ethical research. In the long run, we should expand the horizon of partnerships in community engaged research to include more researchers and explore how existing and new funders can support disability community engaged research, including foundations that are relatively new funders of issues in genomic and disability justice. We need to approach private donors and industry partners, especially those requesting access to the data. Now, this would require concerted effort, both educational and outreach efforts about community engaged research, especially disability community engaged research, both by researchers who are involved in it, journals that publish studies, including community engaged research, and professional societies. And again, I think that the ethical responsibility is really heavily on the shoulders of research institutions. To be trustworthy, they must walk the walk of disability community engaged research, for example, by leveraging the power as owners of extensive data set to select service providers that assure disability accessible platform in research efforts, which is a major challenge for engagement with the disability community, including research participation, and to commit to rigorous community engaged research as part of the scientific inquiry, as well as responsiveness to the outcomes of such efforts. In addition, we do have to think about how we can extend existing ethics regulations to include community engaged research. And I still hear Holly and Barbara sort of saying there's already too much regulations, too much restrictions. And I don't think that's my point here. except for the fact to highlight that currently the common rule and research ethics oversights, that is even the IRBs, are not tuned to community engaged research, especially again when they're supposed to engage with the disability communities. They focus on protections of individuals, not groups or community partners. They require city training that are overwhelming and intimidating for community partners. In addition, many of the IRB approved material, platforms, and procedures are actually not disability accessible and therefore really have created a barrier for community engaged studies. And IRB members often have limited understanding of the socio-political aspects of disability and community values, raising the questions about whether they can properly consider risks for group harms. So we need to enhance research ethics administration to account for community engaged research in general, and again, specifically with regards to disability communities. I'm not going to say too much about that. I'll just say quickly 3 suggestions. One is we need to start thinking about how research institutions and IRBs can develop community engaged friendly procedures to assure protections for community partners, such as funding and flexibility in the format of training in responsible research. I'll just give a shout out here to Research for All toolkit, which is an excellent toolkit to an alternative for city training for adults with intellectual disability. We can also start thinking about how IRBs will create protocol templates that are informed by marginalized communities, some of which are freely available online. With regards to the disability community, there are different resources, and I'll say that one of the projects that I'm working on, we're developing the Engage Toolkit that is coming out soon. And the toolkit will allow researchers to create tailored IRB protocols and related materials, such as supported decision-making templates, all in easy read formats, as well as to access very rich disability education and legal resources to enable the responsible inclusion of adults with intellectual disability in precision medicine research and other biomedical research. This toolkit is all online, it's digitalized, it's funded by NIH, and is developed via an academic community partnership, including mostly adults with intellectual disabilities alongside other experts, and is empirically tested with both adults with intellectual disabilities, and soon will be tested with researchers as well. So these are the types of sources that can be actually useful for a lot of other populations as well. But again, we need the openness and willingness of IRBs and research institutions to actually adopt these types of products, because they include all the relevant information, but just in platforms and approaches that are more community informed. And then third option is, I'm hearing that there are already some universities that actually have created community engagement IRBs, which could be a great addition to existing ones, as long as, of course, we assure that they do have some training, including about community engagement, about different marginalized communities, have proper representation, as well as education about disability communities. And then finally, I think exactly because so many things these days seem afloat in the field of research ethics, we have an opportunity to reconsider how to embed community engaged ethics in data governance structures. Currently, data governance frameworks largely focus on data security, data quality and management, easy access to data and technologies. Ethics is often mentioned, but commonly not properly supported, as we've seen with regards, for example, to the recently published case of the ABCD study. And this kind of risk of ethics not being fully embedded in those structures is that we risk broad participation in research and increase the possibility of group harms, again, undermining communities' trust and potential collaborations in the future. So all research actors should work with communities to resolve the difficult questions that we have somehow pivoted so far, such as who should own the data collected in community engaged research and research more generally. Who is a legitimate representative of communities? What sort of engagement justifies data ownership? And how to distribute the profit from such collaborations? And we have to think about data sharing. If data sharing is grounded in a public good, we should discuss with communities what this public good means for them and what sort of studies are the best investment of limited public funds and scientific endeavors. And we should bring back to the table the question of benefit sharing that somehow fell off quite a while ago, even though it is really the very underpinning of scientific efforts, push for diverse recruitment, and broader implementation of the principle of justice in research that, again, just somehow fell through. So what is the future of disability community engagement, engaged research, and research ethics? I think research ethics does not live in a vacuum of recruitment and compliance with human subject protections, but is contingent on a broader research ethics ecosystem that is central to who gets to decide about research questions, priorities, and outcomes. And as such, this community engaged research, including specifically disability community engaged research, should occupy a greater role in research ethics regulations, administration, and implementation. This is really the building block for trustworthy research, science in and of itself, and a prerequisite for good science. And I think that especially these times really call for all of us to act, and they give us an opportunity to adapt and evolve through new collaborations and efforts to identify shared agreements on difficult questions that are, again, in this area of research ethics. A quick thank you to my collaborators and partners. I could not have done any of that without them. Funders, research participants, community partners, our research collaborators, as well as more information about the Engage Toolkit. If anyone wants to scan the barcode, that would be, you'll get an update when things are ready for full reboot. Thank you very much, and I look forward to the discussion.
Thank you, Dr. Sabatello. Thank you both, Professors Bonham and Sabatello. And now we'll take some questions from the audience. Please ask your questions by the Q&A function on the Zoom. And remember that you can use the thumbs up icon to vote up questions that you want to ask our speakers today. We do have a few that we already started out with. Some people have been putting some questions in the Q&A. So first of all, number one, I think, is how do you get, that this is for both of you. How has the recent government policies or the policies over the past year and a half affected community engaged research, particularly those around DEI? I'll let either of you take this one.
Well, I'll start. Clearly, there have been a number of grants that were funded that were stopped, as I understand. That clearly can have an impact on community-based research. I think one of the things that's really important for the research community to continue to do is to look at how our government is supporting community-based work in a variety of different disease and disciplinary areas, because it's important that we continue community-based research within the recognition of the priorities of the current government. I know that issues of trust has been identified as a priority area. And so it's important that there is research that's funded that's continuing to support that work. But clearly there has been challenges for community-based research.
Yeah, and I think the main question was on trust. What happens, has the trust in our communities dissipated? And then how do we deal with that as researchers? So Dr. Sabatello, you want to take this?
Yeah, I agree completely with Vance. One of the issues is just to find options that do support it. And again, NIH still supports community engaged research, including specifically with disability communities. So I think that's a good sign. I see myself as responsible to the communities I work with. And I think this is where we are. We've got to share with them the information, discuss with them, and move forward. They want their work to come out. They want the research that they've invested in to be out. And I think when you have an open conversation, and it's not that you just vanish, folks understand. People are collaborating because everyone wants to have the right science out, and we want to do good science, and community voices is important for science. So they're happy to continue if they can. Yes, it's harder on the researchers because it does make you feel uncomfortable. If I think about power sharing and that aspects, then yes, there is power imbalance that is created. But again, I do feel that as a researcher, I have a privilege, and I also have to make sure that I work with the communities, and I'm very transparent about what's going on.
Thank you for that, Dr. Sabatella. I want to go to a comment that was made, and there were a lot of up thumbs on this comment that some people believe that the misperception that on the slide that you showed, Dr. Bonham, was on the power dynamics might have been attributable to the greater knowledge held by the scientists or the researchers. Do you want to comment on that?
No, that may be a part of it is with regards to a difference with regards to knowledge level. But I think that requires then there's a responsibility of those researchers and scientists to recognize that and to make sure that they are engaging appropriately the community members, the patients, the advocacy groups from the perspective of their experiences and the knowledge that they bring to the table that's different. And so a recognition of that there are different skill sets, different expertise, different backgrounds that everyone brings. And you know, that project was an example of that. But we can talk about different types of research that's community based, and this question of power, I think is always important to be thinking about.
Anything to add, Dr. Sabatello?
Yeah, I think power dynamics exist. And I think one of the things is to actually engage with the community about the power dynamics and what would be helpful for them to address that in order to get to the best science. Sometimes bringing everyone to the same room is not the best strategy. We have to find where they're comfortable and where they're going to be sharing their feedback and views in the most open way, again, with the goal of creating more accurate science. So it goes back to transparency and trust.
I think there's also, which both of you have nicely pointed out, there's this component of humility that has to exist. And Vince, your comment as well about recognizing something that I tell people all the time is Native people have expertise. When you go into their communities, they're experts on that. So thank you for those comments. Another question is how, as IRB members and the changing expectations in research, where can we go for better training for our IRBs? Obviously, there's the required IRB training, but are there any other recommendations you have, particularly given the financial stressors that our universities are under? Let either you take this.
Go ahead, Vince.
What I would just say is that I think actually this is another place of having conversations with the community about what are some approaches that might be valuable and helpful to IRBs that are related to training that would be important and get insights from that perspective. Too often we are just, we've been following and using the same training approach for the last 30 years and thinking about it maybe in a different kind of way may actually create some really innovative new models. And I think that a type of an opportunity is available to us today.
Yeah. And I think, again, I'm going back to some professional organizations. Primer has had a conference and it's, in hybrid of both in person and remote. There's a lot of trainings and messages and information that comes through those organizations. And so I think this is one way of getting it. There are webinars that they're organizing to educate their members. There are a lot of online and free resources. Again, I shared the project, the Engage Toolkit that we're working on, but there are other projects. And I think that's part of the value, right? Is putting it out there in order to inform how research is being done in an ethical way. So I think we need to have the openness to use those tools.
Thank you both. There's more questions around the IRB, and some folks want to do community engaged research and they want some consultants for that research. And so how do you go about engaging trusted members of the community, good consultants for these IRBs? Any hints on that? And also, someone still doesn't understand what a community, that came out negatively. What is a community-based research IRB model?
Naya, you want to take that?
Well, community-based, yeah, thanks. So community-based IRB models are simply such that are trying to figure out, again, there are differences across the universities that have them. I haven't done a systematic review of all of those that exist, but there are a couple that I know. They're trying to distinguish between, for example, research participants and community partners. because they are not necessarily in the same role. And sometimes they do have a dual hat, that they're both research partners and research participants. IRBs need to be able to distinguish in terms of protections. That's one of the things they're doing. Ideally, they'll be able to look at other issues that involve communities and how they're being protected in this type of environment and studies. Again, I don't know how many of them have it. Obviously, there are some requirements for community engagement in emergency cases. For example, if you're trying to use a new drug and there's a lot of questions around it and there's urgency, then there is some opportunity within the guidelines to actually there's requirements to doing community engaged research and engage the community to get their views. But this is different than usual studies that we do in regular times. But it does require, again, more awareness about the relationship between researchers and community partners, because otherwise we still think about research regulations is something that creates some sort of a hierarchy. There's got the researcher versus the research participants. With research partners, they're equal partners, and we have to treat them as such. So again, thinking about what sort of city training they might need to go, or how we train them, or how we account for their time. How do we protect them as well, both as partners and as research participants? These are things that those IRBs can look at.
Thank you. And Dr. Bonham, as far as getting trusted community folks to consult for community engaged.
So, I think it's always important when you're thinking about consultants on projects is what is their role and how, the relationship with the community, and are they truly community based, or are they just happen to bring a different perspective? And I think we always just need to be asking those questions. But clearly having consultants that are from the community is important part of the research project. But I think it's always important also to say, is this person still representing the community? Or are they representing me? And are we getting really the input that we want from the community? I think those are just challenging questions we always have to ask as we work with various consultants.
Thank you both.
And I do want to say, we can't just have consultants coming as token. That just is not, it's not helpful for anyone. So I think the questions that come up from it is really asking the difficult questions. What do you need this person for? Is it because you want someone to kind of claim that you have that diversity, or is it because you want a different view, or is it because they represent the community and you're actually going to listen to what they have to say? And I think these are different aspects, but it's important to ask them.
That's excellent. Thank you. Dr. Wolf, do we have time for one more question? Okay, one question that many people have chimed in on and want to know, I'm guessing you were expecting this to some extent, what role do we all play as researchers and as academics as well in calling out questionable research being platformed, as we all have seen with the vaccines? So what's our role there as community engaged researchers? Do we have a role to play for our communities in that regard? Dr. Bonham or Dr. Sabatello?
Well, I'll just start by saying I think as scientists and as community-based researchers, we all have a responsibility to make sure that we are communicating with the public about the importance of rigorous high quality science, and that is always an important part of who we are as scientists and representing advancement of the field. And this gets back to the issues that I talked about with trustworthiness and thinking about trustworthiness of yourself as a researcher, that you always are in a position where you need to make sure that you're communicating appropriately and accurately.
Anything to add?
Yeah, no, I think it's, look, we're all in for good science. And I think we all want to have rigorous science, because trying new medications or vaccines that are not good, it's not going to be good for anyone, right? So we want to be transparent about what we know and what we don't know. And hopefully, again, we can discuss that with open minds.
All right. Thank you, Professors Bonham and Sabatello, for your leadership in this area and for joining us on this important topic. Thank you both for sharing your insights. I'll now turn it over to Dr. Robert Hampshire, who will moderate our final session on involving research ethics to manage cutting-edge technologies. Miigwech.